Well, thank you, Mr. President. I thought Senator Klein was going to tell me why he liked the bill, so I asked to go after him. So, alrighty, maybe he'll save his liking the bill comments for later. So, anyway, Mr. President, this is, well, it's an amazing bill. I don't know if we've had a bigger one for human services. Perhaps, I don't know, but it's, it's 844 pages. And I remember we talked a couple years ago about this giant bill. It was something Rex, we called it. This is actually kind of a billosaurus itself, Mr. President. And it's, there's definitely some primitive elements to it that really should go back to conference. Some more thoughts, some more dialogue. Mr. President, one of the things that everybody says they favor about this process here is transparency and openness in government. And I think that actually everybody in this body, and even those who are going to vote for this thing later, would say that they really appreciate that the people know. Open the windows of government. Let us see what's going on. Have the dialogue. And we do that, Mr. President, in a couple of ways. We have, we go talk to our constituents. We figure out a bill a problem we want to solve and a method to do it. And then we have a committee process to go through that. And if we don't quite agree on the committee process, then they go to a conference committee. And Mr. President, I never took a political science course, but I remember from high school when we had our little mini civics course, they talked about that one side puts a bill in and then the other side does. They don't agree, it goes to this conference committee. And they mentioned something that I remember Mr. Wanstrom telling me about. And that word was something about meetings. And they would actually sit down in this hypothetical world about my high school little civics class. They talked that people would sit down and would, agree or disagree, whatever. They'd work out their differences, and when that got done, then they would move it, and then both bodies would have to go approve it or not. Mr. President, and they say the minority debates process and the majority debates policy, and I'll get to the policy, but I don't remember a time, Mr. President, that a bill of this size, 844 pages long, both sides left about 500 pages in that range, which is pretty big anyway, where we met 2 weeks ago on Thursday, went through the spreadsheet of side-by-sides, and then pretty much the cone of silence dropped, Mr. President. And as a conferee with some seniority on the topic, a week went by, and I thought, when's there going to be a meeting? And then 12 days went by, and we finally got together 15 days later, Mr. President, to go through a spreadsheet that was announced that it was closed already. And I looked at that spreadsheet, and I had a few questions that had come out only very briefly before that meeting. And so I really didn't have a lot of time to digest it and no language to judge the merits of some of the elements about. And so I kept waiting that was on Friday, and then thinking that, I was asking staff, do you think some of the reviser people, how's that coming, that bill? Do you think we'll be meeting on Saturday? So I kind of kept my schedule open for Saturday, and then for sure we're going to meet on Sunday. And to my surprise, Mr. President, this 844-page document was posted right around 12:30 this morning. I checked, but when I went to bed at midnight, it still hadn't been posted. I decided I'd go to bed. So I woke up at 6, and there it was sitting looking at me, 844 pages. I began to look through it. I recognized some of the topics. Some I did not recognize. And my only thought, Mr. President, was thinking, this bill should be heard. And, Mr. President, that hearing occurred this morning. And that hearing on 844 pages lasted 1 hour and 15 minutes. And I had a number of questions. And I had many more that I chose not to answer because it's clear that the intention of the chair, Liebling from the House, was to get done and get this thing gone. And so it's not a good way to do business, Mr. President. And, you don't vote no on a bill just because you don't know what's in it, but something 844 pages and $3.5 billion seems like that's something that should be decided by more than two people in a room, which is what this bill is. And, Mr. President, I have the highest regard for Senator Wickland. I think that she is just a marvelous legislator and attuned to the desires of, your caucus in particular. But she's open-minded on some things with stuff that I want to bring up. And Representative Liebling was on her side, and they sat down and conjured up this 844-page Billosaurus. And, sometimes, Mr. President, it's frightening if you see a big dinosaur, like a T-Rex or something. And if you were like in some of those movies where they get loose and then they eat people and you're running away to try to hide and they bite the top of your car off, and it's frightening. And so that's something you can see that you're afraid of. And Mr. President, sometimes you're in a dark room and you hear a T-Rex, and it turns out it's only a recording, but you're just as scared. But sometimes, Mr. President, if you don't know what's out there and you hear noises and it really isn't, you're not in a dark room with some kind of a video of the audio thing coming at you, you're afraid of what you don't know. Mr. President, we simply don't know what's in this bill. We just don't know. There's accolades I think you're going to hear from people about how this is, actually Senator Liebling said it's a great bill, and I appreciate her opinion, and Senator Wickland went through a few of the highlights, and there's some highlights, Mr. President. But what we've seen in this year has been where the bill that left the Senate, we understood that really well. It was heard, there were a lot of hearings. I didn't agree with everything, and that's the way this place is, Mr. President. I voted for that bill, leaving the floor, because I liked a lot about it, and I knew what was in there, because Senator Wickland thoroughly heard everything in our committee, and that was a good process, Mr. President. And Mr. Wanstrom, Demar Wanstrom, my civics teacher, would have been very pleased with Senator Wickland, and he would have given her probably an A for the process. And so now we go into this other process, and I kept asking, and a week went by, Mr. President, and I had no news. And I heard there were some troubles, although nobody talked to me. In fact, I was carrying around a card, Mr. President, where I had kept track of all the dialogues I'd had with the people, and looked like this. It's not a prop, Mr. President. This is a document. And on the bottom, I signed my name to this blank card attesting that nobody had talked to me at all on anything by any conferee. And that card, actually, Mr. President, was good for 15 days. No conversation. And I understand that they couldn't talk to everybody. It was 34 on our side of the aisle, and Senator Utke, they could have talked to him, but he wasn't a conferee, but I was. And so in the process, Mr. Wanstrom talked to me about that I thought for sure I'd be consulted at some time. And so, Mr. President, I even went so far as to write notes to Senator Wickland and Representative Liebling to say, I'm happy to help. Maybe we should have a hearing. And Senator Liebling did reply to me, Mr. President, to my request for a hearing. And I have to thank her for that. She texted back, so noted. So that does count as a dialogue. So, Mr. President, so I can't say I didn't have any communications, but that wasn't particularly helpful. And so time goes on, and I heard there were some troubles in the negotiations, and so I wrote a note to the governor and to the speaker and to the majority leader in the Senate offering to help, because I thought that maybe could move this along, and so we could actually, lift the cone of silence, which, Mr. President, if you Get Smart, that is like just one of the funniest things. Like they put this little cone of silence down, and then ironically, in one of the ones, the cone of silence didn't work, and Maxwell Smart was saying just a bunch of foolish things, and everybody heard him. But that didn't happen in here, Mr. President. There was no leakage from this cone of silence. In fact, there was none. And I asked a few other conferees, how they were doing, and they said, don't know. I'm not really part of the meetings either. So I have a lot of confidence in those two people. But, Mr. President, when you're spending $3.5 billion and affecting the lives of literally more than 1 million Minnesotans, it seems like it might be a good place to have a little bit of input. And so that's the process, and the students can argue on their master's papers how process should be, but I think you'd want to consider this one as they have their own particular personal Billosaurus silentis, I think we should call it. Yeah, that's good. Billosaurus silentis, as in the cone of silence. So, Mr. President, out of this process, they forgot a couple things. And so one of the benefits of bringing people into a process is you find some stuff you forget. There's going to be testimony, or there'll be people that's jumping up to talk about the wonders of childcare and the healthcare stuff. And we're going to do a bunch of councils to work on healthcare disparities. And those are all wonderful, and you can discuss, about who gets healthcare and how they're going to be open. But Mr. President, I'm going to point out two glaring things which really are going to cause harm to Minnesota that they simply forgot. And when I asked about this, the comment was, well, we're fighting budget constraints. You know, Mr. President, there's never been a health and human services bill like this, including child care. They got to spend $3.5 billion. And by the way, taking money out of what's known as the Healthcare Access Fund to do it, to the tune of over $1.5 billion. And which, Mr. President, $1.5 billion, if people are keeping track at home, that's a lot. And that, some of that money went into health care, and some money just went in to feed the budget. But one of the funny things about the Healthcare Access Fund, Mr. President, and I know you know this, it's a very limited fund. We put like 1.8% of the money from all the health care goes into this fund. And, Mr. President, there was a surplus in there. And, you know, Mr. President, you know why Jesse James robbed banks? Because that's where the money was. And so the reason they took the money out of the Healthcare Access Fund, because the money was there. And I understand, Mr. President, the inability of the majority to live on $17 or $18 billion of surplus. I can't imagine the crisis they had to go through to put a budget together with that meager amount of money, which, Mr. President, by the way, is the record of any time in Minnesota's history. And I understand their inability to deal with that, and so they had to raise taxes and fees to maybe the tune of $9 billion. And I understand, Mr. President, that $26 billion was just not enough to get by on, so they had to take $1.5 billion out of this other fund, which is paid for by sick people, to buy projects in the bill. And I totally appreciate, Mr. President, that out of all that money, they couldn't find $42 million to rebase the hospitals. Now, Mr. President, what is rebasing? Rebasing is setting the rates from the past. Right now, they're working on 2018 rates. Mr. President, do you know that in 2018, things were cheaper than they are now? I don't know, maybe you think they're the same, but you knew, of course, that they're different. In fact, they've gone up a lot in the last year. Some say they've gone up 10%. Now, Mr. President, 10% is a lot of money if you're a hospital working on 2018 rates. And do you know, Mr. President, some hospitals are losing $1 million, some systems are losing $1 million a day. Now, that seems like a lot of money, but if you do it for a year, that's $300 million, which is a tremendous amount of money, and some are close to going out of business across the state. And so it seems to me, if I would have been there, I would have mentioned, by the way, don't forget to give the hospitals some money, because you're going to add 40 to 80,000 new people as we add undocumented Minnesotans into healthcare, which in the opinion of many is a great idea, and you want to think it through if it's that good of an idea or not. But so in the opinion of the two conferees who were deciding everything, they thought this is a great idea. The Senate, Mr. President, was a bit more restrained. They just did children. And you can understand that helping children and, want them to get on a good start, help their various, ear infections and all that. And there's some sympathy for that. But when they got to the conference, they decided to cover everybody. Now, perhaps that's a good idea, and we might be discussing that later. But, Mr. President, in the financing of hospitals, there's a couple different rates that get paid. One is cash, and if you have cash, actually they're allowed to charge only the amount of the highest of the commonly charged commercial insurance policy. So you maybe pay 70% of whatever the retail price is. Auto insurance pays 100%. Right, Senator Hupke? Anyway, so that's really the cash cow. If you have a car accident, they can make some money there. But then you have Medicare, which pays in the 60% range or something, and then you have medical assistance in Minnesota Care, which pay in the range of 40%. And so, Mr. President, if you have costs that are in the range of 60%, and you get 40 to 80,000 new people into your systems that want to get a lot of care because they haven't had much care, as some would say, we had testimony, and it's compelling, Mr. President, the challenges they face. So now we're asking these hospitals, some of them are already losing $1 million a day for the system, to add those in and not give them any more money. And, Mr. President, that just totally confounds me. We talked in the last couple of days about nursing homes, which the governor decided didn't need any money. And so on our side of the aisle, we said they need money. They're closing. They're in desperate straits. And so we made a big deal out of it. We argued about it, and the view of the administration was nothing to see here. And finally, push came to shove, and they rolled over to give us $300 million for nursing homes. And because of that money, Mr. President, 30 nursing homes are not going to close, the ones that they weren't even worried about. So the same administration, the same governor who is so happy to add in 40 to 80,000 new people into the system and programs that are losing up to $1 million a day, decided that we should not put any money in. And so, Mr. President, in the conference committee, I had an idea. There's $22 million of unallocated money in the bill for some future study of a public option. And so I thought, since they clearly forgot this, let's just have a motion to move that money into the hospitals. And that was, well, actually, I kind of irritated the chair with that motion. But I know she cares about hospitals and the integrity of the healthcare system, and so we voted, and unfortunately, there were 2 yeses and 8 noes on that motion. And sadly, Mr. President, another party line vote to not care about hospitals. And I don't understand, Mr. President, what it is that hospitals have done to aggravate the governor about him not wanting to pay for it out of a $3.5 billion bill with $26 billion to spend, and many of whom are truly on the ropes for all kinds of reasons. So that's disappointing. And just one thing else I'll mention that I would have brought up to do, and that's the mental health care, Mr. President. I think if you asked any one of us and people on the street, is mental health care important? Well, they would say certainly yes. It's very important to have mental health care, and we need people to go to their providers, counselors, psychologists, licensed professional clinical counselors, and the rest to get their care. Well, Mr. President, I don't know if you know, but the people who are on the low end of the economic scale have to use Minnesota Care and medical assistance to go to their doctors. And we were so proud when we did the Obamacare expansion that we covered all kinds of people in the Minnesota Care and medical assistance programs, and that was a big win. Well, Mr. President, unfortunately, those mental health providers can't afford to work at the prices we pay. And so there was a proposal, which the Senate adopted part of, to give them a 35% rate increase, which would not make them wealthy, but at least would make them break even on their time. And with the budget constraints that Senator Wickland had, I want to commend her. Again, another B plus on this one, Mr. President, for sending over an 18% rate increase to conference. And so, but the final result, Mr. President, was 3%. And I don't know what 3% even means. And, you know, there's some substance use providers who are trying to help people kick the habit and help people not die from being in substance use. And it was decided that they didn't need any increase because they're fine. And, Mr. President, if you want to go talk to the substance use providers and the medical assistance providers in the mental health side, they will tell you that they are committed to their service. They are passionate. They really care. But in $3.5 billion on a $26 billion budget, they didn't get anything. And so I just want to ask you, Mr. President and members, why I'm encouraging you to send this thing back. I have one more reason, so don't jump up yet, Mr. President. And this is going to be a shorter on this topic than you might have thought I would do on the last topic. Out of $26 billion, all of us in this chamber are committed to people's mental health, and we're committed to their substance use. We don't want anybody else to commit suicide. We talked about suicide a lot on the floor, that people should get care, and for various reasons why people may be suicidal. There's an article in the paper yesterday about farmers who are suicidal. And it's just tough times. And so we've decided as a state for people who are low income on Minnesota Care and medical assistance that we're going to make it possible to go to the doctor of their choice. Only it's hard to find one that they can go to. And so this would not be a problem. There's actually extra money in the bill, and there are a couple things that could be easily jiggered around. It wouldn't take long. It would not kill the bill, Mr. President. This could be tackled in just no time, and I assure you, I would encourage my contemporaries on this side of the aisle to say nothing when it came back if we can get these two things fixed. And finally, Mr. President, something that I was praying would not happen, that we'd have enough discussion about already on the floor, and that's the wonderful topic of abortion. Now, I don't know, we've covered a lot. We've spent days on the floor talking about this in various ways. We're an abortion sanctuary. We can have abortion from conception all the way up to like the day before birth by a 14-year-old with no parental consent. Got it. because they ran on Roe versus Wade needed to be protected, and across the country they're changing all the laws. And I got it. I listened, and that got accomplished, Mr. President. On the list of accomplishments is that thing on almost every list that your side's putting out. And so I thought, well, that's pretty good. I mean, at the doors I heard about this, problem solved, at least by one side's resolution. And doctors can do it, and they can have a sanctuary and all that, and like, fine if that's what you all want, and I didn't agree with that either. But I understand, Mr. President, elections matter, and like that topic was thoroughly covered. But in this bill, Mr. President, are probably 15 things from Senate File 70 and House File 91 that I thought were quietly put to rest. In fact, I heard members of this body, Mr. President, saying they're not going to vote for Senate File 70. There's things in here that we're going to talk more about, I suppose, including born alive. So a baby is born after an abortion. They're alive. That they have to be given significant care and records kept about the status of this 23, maybe 24-week-old born alive infant who is now deemed to be a person. Mr. President, this bill decides to repeal that and replaces it with a woefully inadequate, very dangerous paragraph, which I think will come up later. It is not the same. And this also repeals positive alternatives. Now, Mr. President, we can argue about abortion, and I'm not going to relitigate it much past this single topic because I could spend the rest of the day on this because I'm pretty upset about this even having to be here. I just don't know why it has to be in this bill at all. I could have voted for this bill, Mr. President, even with all the things that I didn't like about it, and even forgetting covering the hospitals and the other mental health providers. But why do we have to keep this topic coming up? Why? The people at the doors, if you would have asked them, for all the people that were on the side of we need to fix Roe versus Wade, so do you think when a baby is born alive, we should take away the protections from that baby to be properly cared for? Do you think that's something they would go like, what, really? No, I just think that somebody should have the opportunity to have an abortion, maybe after they're surprised and for maybe the first trimester for sure, and maybe a little longer. That's what the Netherlands says, Mr. President. But in here, and I'm not going to itemize many of these, I could really go on a long time, and I'm not being dilatory, but I'm just being really frustrated, and I'm being very open with you, Mr. President, with my sincere disappointment that we could not discuss these in conference. We never had a chance to discuss these in conference. We've never debated this on the floor. We debated it briefly in committee. And so I don't know why that has to be in here. Mr. President, I urge that we send this bill back to conference to do three things, which will be toward the one Minnesota that our governor is so keen on, and toward the unity that we talk about working together and getting things done, which is what people want us to do, Mr. President. If this bill goes back in about an hour, they could fix the hospitals, they could fix the mental health, and they could restore. They could take this abortion stuff out, and you all could declare a victory lap and say, well done, look what we did, and we can move along. So, Mr. President, I urge a green vote on the motion to not concur.